Hola, muy buenos días, buenas tardes.
Good morning, good afternoon, and welcome to this press briefing here at PAHO on the COVID-19 pandemic in the Americas. Today, Wednesday, November 3rd, 2021. My name is Luciana Viegas, Public Affairs Advisor for PAHO. I will be the moderator today, which will be for about an hour. And we have interpretation into Portuguese, English, and French, and you have the option by clicking on interpretation. We have already received your questions via email, and you can also ask your questions by using the Q&A button. Please do include your name and the media outlet you represent when sending your questions. Today, Dr. Jarbas Barbosa, PAHO's Assistant Director, will be reporting on the COVID-19 situation in the Americas, as well as our recommendations for traditional or booster vaccine shots. With Dr. Barbosa, we have Dr. Ciro Ugarte, who is Health Emergencies Director with PAHO, and Dr. Sylvain Aldiguiri, who is Incident Manager for COVID-19 at PAHO. Now, I would like to invite Dr. Barbosa to share his opening remarks and share with us the regional update. Dr. Barbosa, you have the floor.
Thank you, Luciana. Welcome and thank you for joining today's briefing. Over the last week, the region of the Americas reported more than 745,020 new cases, new COVID-19 infections, and just over 18,000 COVID-related deaths. This is the 8th consecutive week that overall cases have declined in the region. In North America, all 3 countries reported drops in weekly cases and deaths, and there has been a notable decline in hospitalizations in the United States and Canada. There have been similar declines across most countries in Central America. After weeks of a persistent outbreak in Belize, I am pleased to report a nearly 20% decrease in cases and a 60% decrease in deaths. The same downward trends are present in much of South America, save for a few exceptions that we are monitoring closely. In all countries, there are publishing data about the vaccination status of the hospitalized cases. A very high percentage of those hospitalized have not been immunized against the virus. Consistent with the other parts of the region, cases and deaths are trending downwards or remaining stable throughout much of the Caribbean. However, Barbados continues to report its highest number of COVID-related infections and deaths since the start of the pandemic, and there are concerning shortages of hospital capacity in the Dominican Republic and Trinidad and Tobago. The progress in our region is not a reason to become complacent or discontinue the public health measures that help keep us safe. Quite the opposite. The declining cases and deaths shows that our approach is working, and it is critical for all of us to stay the course until everyone is vaccinated and protected from the virus. To date, 1 billion COVID vaccines doses have been administered across the Americas, and 46% of the population of Latin America and the Caribbean has been fully vaccinated. At least 32 countries have already reached the WHO's target of 40% vaccination coverage, and several more are on track to reach and surpass it by the end of this year. This progress is encouraging, but not surprising, thanks to our region's strong immunization systems. However, there are still several countries facing delays and 19 that remain below the 40% target. PAHO is working closely with all these countries, especially Haiti, Nicaragua, Jamaica, St. Vincent and the Grenadines, and Guatemala, which are still below 20% coverage. Vaccine ineptity remains the biggest barrier to reaching our coverage targets. The COVAX facility, with the support of PAHO's revolving fund, has delivered 64.3 million doses to the region. Roughly 30% of these vaccines, over 19 million doses, were donations by the United States, Spain, Canada, and other governments. We are thankful for these donations, which have improved the situation in the Americas. We continue to expect allocation of vaccines from COVAX to accelerate in the coming weeks. So we urge countries to monitor their absorptive capacity and to continue to scale up vaccination operations. PAHO is providing technical cooperation to our member states in all relevant aspects to guarantee successful vaccination. Communication strategy, training healthcare workers, adopting new strategies to facilitate the access of the population and cold chain capacity. We are also supporting countries to overcome supply problems with syringes and diluents. That means we must make investment in immunization capacity and staffing a top priority. Our investments today will pave the way for a strong recovery after the pandemic. As more vaccines become available, countries need to make decisions about how to prioritize doses among their populations. These decisions are ultimately up to individual countries based on the vaccination coverage and the availability of vaccines they have, but should always be based on evidence, equity, and the commitment to protect our most vulnerable. So, I want to reinforce the latest guidance from the WHO Strategic Advisory Group of Experts on Immunization, SAGE, on a couple of key topics. The first is the bedrock of our vaccination strategy, that of vaccinating the most vulnerable. In some countries, we have seen vaccine doses reaching all levels of the population before a high percentage of vulnerable groups are fully immunized. PAHO urges countries to prioritize the elderly, frontline workers, and people with pre-existing conditions to protect them, but also to prevent the health system from becoming overburdened with severe cases. This recommendation by SAGE, an independent committee which advises WHO and PAHO, is based on the most robust evidence available. When vaccine availability is low, it is best to protect the most vulnerable first. Once those at greatest risk are protected, the next step is to immunize a high percentage of the adult population. Only afterwards should countries consider vaccinating younger groups. We have no evidence at this time that vaccinating students should be a prerequisite for reopening schools. This staged approach lays the best foundation for countries to reduce the circulation of the virus and eventually get their economies and societies back on track. The second is how to determine who needs an extra dose. Currently, we recommend providing an additional dose to only two groups. First, people who are immunocompromised, regardless of which vaccine they took. These include cancer patients, HIV-positive individuals, people taking some medicines like corticoids, and transplant recipients, and people over the age of 60 who received an inactivated virus vaccine, such as Sinovac or Sinopharm. These individuals need an additional dose to be protected from severe diseases and the risk of dying from COVID-19. And their vaccination cannot be considered complete until they have received their third shot. There is not enough evidence yet to recommend booster shots for other groups who are fully immunized, especially when vaccine availability is limited and many in our region still have not received their first shot. Our ability to quickly develop safe, effective vaccines against a new virus like COVID-19 has been a model of scientific innovation based on years of research, and our rollout of these vaccines is based on our vast public health experience in immunization programs. PAHO continues to work tirelessly to make these vaccines available to everyone in the Americas. But we are aware that most countries in the region still don't have enough doses to protect all adults, which makes it critical to follow expert guidance and maximize the impact of the doses that are available. Vaccination alone is not enough, but combined with effective public health measures, it is our best strategy for reducing COVID-19 transmission and saving lives. Thank you.
Muchas gracias, Dr. Barbosa. Pasamos entonces a las preguntas.
Thank you very much, Dr. Barbosa. Now we are going to move to the question that we received via email and also through the chat. Please remember to indicate your name and media outlet. We are going to start with a question from Barbados. I will speak in English.
From Barbados today. This is a question for Dr. Ugarte. Given the current wave and Delta strain and the continued climbs of COVID cases and deaths in Barbados, in addition to hand washing, mask wearing, what other measures do you see as deterrent to the spread of the virus? And the easing of border, a second part to the question, how can countries find the balance between opening up for tourism and halting the spread of COVID? Dr. Ugarte?
Thank you for this question. It's a question that is recurrent in many occasions because we must recognize that all the variants of the virus that causes COVID-19 spreads from person to person mainly due to a close contact with an infected person, being that person symptomatic or not. So having that into perspective, every measure that will reduce the possibility of an infected person to transmit the virus to others are the measures that we need to maintain all the time, even when the populations are highly vaccinated in the communities. The main protection that has been, the evidence is widespread, is the use of masks. The use of masks will prevent the transmission from a person infected to others, but also will protect the persons who are in close contact with others that are using masks from being infected from another person. Of course, disinfection of hands is the other measure that also proved to be very useful, particularly when you're touching places where several other people may touch also and may get infected or may have viruses that are active. And in addition to those, we have been also including other measures including reduction of mass gathering, particularly in places where people come from several other locations, and also to have better ventilation in closed environments, for example, in restaurants, where many people will take off their masks because they will eat, of course. And in those places, it is very important to have better ventilation. And in those occasions when you are, if possible, you use your masks as long as possible. And also to reduce the distance in meetings, in schools, and in other places, in airports, in several other places, this physical distance is still a very good measure to reduce transmission. So meanwhile, we have this transmission in most of the countries, including Barbados, but many others, where in some locations we saw an increase of number of cases that may eventually overwhelm health services. These measures are the ones that are very useful. Regarding the easing the travel restrictions, it is important to highlight that the vaccinated persons, as Dr. Jarbas already mentioned, and we have been mentioning also several times, are better protected. Maybe will not completely eliminate the infection, but they are way more protected than the persons that are not vaccinated. And in that regards, allowing the persons who are vaccinated is a very good measure. But what the recommendation of WHO and also PAHO is not to restrict the travel of essential travels of persons who are not vaccinated, because the vaccines are not widely available, unfortunately, and it is a very important measure. And also recognize that when you reduce the restrictions for travelers, you recognize that you are accepting a certain level of risk. So in the communities that are accepting, or the countries that are accepting visitors, it is important to keep in mind the local transmission, and also to strengthen the surveillance capacity and to track what is the capacity of the health services and provide the visitors with clear, very easy to understand information so they can get health services as soon as they feel some symptoms or they think that they may have been in contact with a symptomatic person. So these are the measures that will reduce the transmission, and eventually will help also the tourism to be safe for tourists, but also for the communities that are receiving them. Thank you.
Muchas gracias, Dr. Ugarte. Thank you very much for your answer. Recibimos algunas preguntas, claro, sobre la vacunación.
We received some questions about vaccination of children. We are going to group them together. We have some questions from the Health Web in Panama. How is the child vaccination process moving along in the Americas, and also PJD in St. Martin?
The CDC panel recommendation on the use of Pfizer for children between the ages of 5 and 11. What does that mean for the Caribbean countries still struggling to vaccinate their citizens? And how will PAHO help with the latest vaccine development? This question, Dr. Barbosa, perhaps for you.
Gracias por las preguntas. Hay mucha...
Thank you very much for these questions. There are many questions around these topics. First, let me underscore the recommendation that we usually make. Priority groups for vaccination are the ones with the highest risk. COVID-19 vaccines have two objectives. The first one is to save lives, and many people will still die in the Americas because the elderly still individuals that have comorbidities, and also some other priority groups have not been highly vaccinated. So that is the priority, without any doubt. That is to say, to save lives with the vaccines. The other goal of vaccination is to diminish the transmission and also circulation of the virus, together with public health measures. And that's the reason why the second group to be vaccinated includes all of the adults, so that we can reduce the transmission of the virus. As to children, Each country will be making their own decisions, and it is important to underscore that it has to do with regulation. The decisions by FDA are valid for the US, and also decisions made by the Public Agency of Canada are valid for Canada. In the case of COFEPRIS, that is for Mexico, and then we have Cuba and Brazil with their own agencies. So all the ministries of health work with their own regulatory authorities, and they are assessing the data and also the studies they conducted. The vaccine producers that have and present their studies and request authorization for use in children. So far, the World Health Organization has not completely reviewed any request by a vaccine producer to vaccinate children anywhere in the world. So the recommendations so far out of the vaccines that are authorized for emergency use by WHO is only Pfizer as of 12 years of age. As for all the others, they need to be used as of 18 years of age. Certainly, the situation is quite different in each country, and some countries already have a large number of vaccines, have more access, and they will already be starting to vaccinate children in an attempt to reduce transmission. But when we look at the data in each country, we see that the problem is not vaccination or not in children. The problem is that we have not still vaccinated vulnerable groups to be able to put an end to the mortality due to COVID-19 and vaccinate all of the adults so as to reduce transmission. That is the greatest priority that we currently have for the upcoming weeks. Thank you very much, Dr. Barbosa. We also have a follow-up questions by Associated Press regarding vaccination of non-priority groups or groups that have not been vaccinated. Do we have any data about countries in the Americas that have vaccinated non-priority groups and which have completed the vaccination of the most vulnerable ones? Do you have anything to say, Dr. Barbosa? Yes, thank you. PAHO has been working extensively with countries in the region to establish plans that need to be implemented in stages. And that is important because the vaccine is not available to vaccinate everyone at the same time in most of the countries. If a country starts offering vaccines for everyone and they do not focus through a communication strategy and outreach on those priority groups, we might not be using the vaccines in the best available manner. So, and this is important, and this can also be confirmed if we look at the country data by age group. We are going to see some countries that have not reached a high 80–90% coverage with both vaccine doses in people older than 60, and they are part of the priority group. So until we complete vaccination with that group, to offer vaccines for young adults, for example, may be diffusing some of the efforts and have those individuals lose their own priorities. So what we should do is to work with the countries to identify what the barriers are, because individuals with comorbidities and the elderly are not fully vaccinated, and each country should be attaining this priority, this goal that is the first goal of the vaccine, so that then we can use the vaccine in the other groups that are not that do not have such high priority. Thank you. Thank you, Dr. Barbosa. We now move on to questions. We start with the Caribbean from The Guardian in Trinidad and Tobago, who is asking.
Transmission high in beaches or rivers, areas where there's a high concentration of tourism, or are they safe for public use? Tenemos también una pregunta de
Similarly, we have a question by Melina Ochoa, TV, regarding All Souls Day that was celebrated last week with great large concentration of individuals and whether this would also lead to transmission. And I move on to Dr. Aldigueri to answer both questions. Thank you.
I will start with a question from Trinidad and Tobago from the Caribbean. And thanks a lot for this question that will help me to once again stress the importance of the public health measures, including in the context of the progress of vaccination campaigns in the Americas. Dr. Ugarte has already commented regarding the importance of the use of masks at the beginning of this press conference. The first aspect, for the important aspect for the public, is to carefully check the guidance from the local health authorities. Public health authorities, national or subnational authorities, have established now for more than 20 months a battery of public health measures that clearly describe what to do and what not to do. So please check the guidance from your health authority. The second aspect is that we know that according to the transmission patterns of a virus, the social distancing and avoiding the closed environments are, together with mask wearing, the most important tools for limiting the transmission. Therefore, the citizens, the public, have to really incorporate these basic measures in their lifestyle, including in beach and seaside and vacation activities. Ahora la pregunta sobre México.
As to the question regarding Mexico, that has several approaches. First, I would like to underscore that we need to be quite cautious when introducing some sort of forecasting. The current models do not allow us to forecast long term. Our regional experience over the last 22 months of the pandemic, in addition to a daily and weekly analysis of the reports that the countries share in the region, allow us to make the following considerations. In Mexico, the constant decline in the number of cases is an excellent piece of news for all of the community from the health point of view and the point of the social and economic aspects, as well as mental health well-being, and this also allowed for social and family events during the All Souls Day celebration. However, in spite of the warnings, we can say that the preventive measures were not completely complied with by the community, with healthy distancing, hand washing, and also the wearing masks, which I mentioned in the previous question in English from the Caribbean. There is a risk for case emergence during winter and also during the end of the year holidays, and this could accelerate transmission among individuals. So all of the alert mechanisms need to be maintained and activated, and I hope I have addressed the concerns by the journalist from Mexico. Thank you.
Muchas gracias, Dr. Aldigueri.
Thank you, Dr. Aldigueri. We have two more questions from Uruguay regarding opening borders, and also from Tobias Käufer from Germany, from the Welt, and maybe I'll go to that one. Dr. Ugarte.
Vaccinated tourists only into the country, perhaps a general explanation. Por favor.
Thank you. This is also another very important question, but it needs a clarification. Costa Rica actually does not require a proof of vaccination as the only condition to enter the country. Neither Costa Rica requires coronavirus detection test or it issue also sanitary confinement orders to enter the country by air or by land. So there are no strict provisions in that regards. But from August 1st of this year, all tourists who are fully vaccinated against COVID-19 that have received the Moderna, Pfizer, AstraZeneca, Johnson & Johnson can enter the country without a travel policy. So that's a provision that will benefit the persons who have been vaccinated. And the last dose of the vaccine must have been applied at least 14 days before arrival in Costa Rica. So travelers who are vaccinated are exempted from purchasing a travel policy that covers COVID-19 care and quarantine if necessary. So it is also an additional benefit for the persons who are vaccinated. Those who are not vaccinated may have to buy a travel policy or insurance to cover the health costs if they get sick from COVID-19 or other diseases. So I would like to emphasize that basically Costa Rica is operating under the WHO and PAHO guidance and recommendations, and also the recommendation of the current temporary recommendations of based on the international health regulations. And those perspectives are also in line with a medical perspective. So in general, when we are looking at the countries that are requiring vaccination for visitors, it is a way to easy or facilitate the entry into the countries. At the same time, there are other additional provisions that are taking place with persons who are not vaccinated and are in general provisions that will reduce the transmission for the visitors, but also for the communities that are receiving them. Again, we need to ensure that all the conditions, the transmission and the country of origin and the country of destination are closely monitored so we can even further reduce the transmission in both sides. Thank you.
Thank you very much, Dr. Ugarte. Tenemos pues una pregunta ahora también.
Now we have a question regarding the other diseases that are seasonal in the winter in the northern hemisphere and in the summer. Gerson asked the season for widest circulation of dengue is starting in countries such as Peru. What recommendations do you have to prepare ourselves for these diseases, these seasonal diseases for either winter or summer, depending on the hemisphere, and for a third wave, possible third wave? Dr. Aldigueri. Thank you for this question coming from Peru, but logically I will be responding with a regional approach because we have all the countries in the intertropical region. Dengue is pandemic in the Americas. It is an intertropical disease, and its vector is present in many countries and territories of our hemisphere. Within the context of coexistence of COVID-19 and dengue in many countries and territories of the region, we recommend the ministries of health and the countries in general to continue to strengthen surveillance, establishing a triage of the patients and access to timely diagnosis and treatment for dengue. In this complex context of COVID-19 pandemic, which has impacted the health systems in general, At the same time, it is important to establish strategies to facilitate access to health services of patients with dengue, and in addition, strengthening risk communication so that patients who have signs of alarm can go to the health centers or the hospitals timely. But we emphasize the importance of primary health center, those health centers that are closest to the communities, to the population. PAHO recommends adequate triage of patients, both for timely detection of alarm signs for dengue, potential complications of infected patients, patients who have been potentially infected with SARS-2, and also to decrease the risk of infections caused by the SARS-2 virus, which could be acquired when people go to the health services in their countries. PAHO regularly publishes epidemiologic updates regarding dengue and other arboviroses. And also, they have published technical guidelines for managing patients who are suspected of having COVID-19 in different in different health service level. And I would like to emphasize again the issue of triage so that infections may be better controlled in the health services accordingly. I hope I have answered the Peru question, which I have extended to include the whole of the intertropical area of the Americas. Thank you very much, Dr. Aldigueri, for clarifying the situation. Now we go to the next questions. One regarding a delivery of vaccine doses to the countries. We have a question from Comercio Peru about the amount of vaccines that have arrived in Peru through COVAX, also from Venezuela. A similar question, when can they expect to get more vaccines through COVAX? Dr. Barbosa, over to you. Do you have an update? Thank you. Thank you for your questions. Yes, there is a great deal of doubt and concern in the countries whether they are going to have vaccines to be able to vaccinate all people, the most vulnerable, vaccinate those who are eligible for vaccination. And together with the public health measures, to reach control of transmission. Peru specifically has received about 2,870,000 vaccines, and they have over 1.5 million Sinopharm vaccines, and those deliveries will begin. The first 236,000 vaccines were delivered on October 13th, and we have the other 1.175 doses that are in negotiations, and the information about delivery dates and times will be reported. Also, 3.8 million doses of Pfizer's are being negotiated between the country and the manufacturer, and hopefully this negotiation will culminate before the end of the year. Regarding Venezuela, after some problems that we have mentioned in prior press briefings, those vaccines are arriving, and fortunately for Venezuela, they have received about 2,594,000 doses of the Sinopharm vaccine they're about to receive in November. By the third week in November, they will receive more doses of vaccine, and they are also in negotiations for 6.2 million doses of Sinopharm vaccine for Venezuela. So how does the process go? When the COVAX Secretariat allocates the vaccines, once we receive the list of the countries in each round of vaccination, we immediately contact the manufacturer and the country to see whether all the legal regulatory administrative and other matters, payments, etc., if everything is ready so that the country can be told the exact date, the exact number of doses, and the flight in which they will be arriving. So this is an overview of what happens in the region of the Americas. Given the 42 years of experience of the revolving fund, and for our region, it is the revolving fund that makes the purchases on behalf um, of COVAX. And so there is a short time between the allocation of the vaccine and the arrival of vaccines in the country. So we continue to work in this way so that the countries can receive from COVAX all the vaccines that have been committed. Most countries have requested about 20% of the population. This is an average, and there are variations among countries. But the COVAX Secretariat has reported that given all the problems that COVAX has had during this year, they will only complete all deliveries during the first quarter of next year. And this is why we have other alternatives for the countries. We are speaking with donors so that more donations can be sent to our region. As we mentioned at the beginning, more than 19 million doses were donated for countries in Latin America and the Caribbean, and this was essential to broaden access. And we also have the possibility to have direct purchases through the revolving fund. Some countries have already sent their requests, and we are in the process of negotiating with the manufacturers in order to start deliveries soon. Thank you. Thank you, Dr. Barbosa. We have also a question about vaccines from Alfia Sumner from the Jamaica Observer.
Advice or a word of caution to countries such as Jamaica that have had large volumes of doses expire in recent days, despite low vaccination rates? Should these countries be concerned that donors may become hesitant to donate the vaccines? Dr. Barbosa.
For this question, I think that it's very important to increase the access to the vaccines. I think that this is the main problem that we have in Latin America and the Caribbean. But in some countries, and Jamaica is one of these countries, unfortunately, we have seen some vaccine hesitancy among the population. So we are working with the Ministry of Health of Jamaica and other countries to develop and implement a communication strategy to reach out the population, to provide transparent information, to share with the health professionals the most recent scientific evidence that we have, to show what is the process to have a vaccine approved, all the tests and clinical trials that a producer has to make to ensure that the vaccine is safety and efficacious. So we are working with the countries because we need to use the vaccines. We need to protect the people, and we need to reduce the transmission. In very exceptional situations, like in Haiti, that had a very important political crisis, and also had some problems in the country, we moved the vaccines, 250 doses from Haiti to Honduras, exactly to prevent any loss of vaccine doses in the region. So we are monitoring this. We are working with the Ministry of Health to ensure that they can use the vaccines that are available. I think that this is the most objective that you have now. Thank you.
Thank you very much, Dr. Barbosa. Pasamos a la próxima pregunta de un periodista de
Now
Bolivia.
to the next question from Bolivia, from Verifica, about the symptoms that people may have. Is there something called the COVID toes? So what do you know about this, Dr. Aldeguerri? Yes, thank you. Thank you very much for the question from Bolivia. After 22 months of evolution of the pandemic, our region really has improved in our clinical knowledge about COVID-19. It has been frequently associated to skin manifestations in adults as well as in children. The most widely reported signs in reports among the medical community are skin signs, for example, rash, vesicular rashes, urticaria or hives, and lesions where the hands, the toes, and the fingers are discolored. So these lesions are reported as so-called COVID fingers and COVID toes, COVID fingers. And according to studies that are variously biased, about 10 to 20% of patients with COVID do develop skin manifestations. Among them, a small proportion of these have had the so-called COVID fingers. And we have seen that those lesions may appear in cases that are more severe and or risk factors, such as, for example, obesity, blood pressure, high blood pressure, and diabetes. However, as I said before, we need to do more research into these phenomena. There is no specific treatment in addition to the general treatment to decrease the inflammatory response in those more serious cases of COVID. Those skin manifestations, such as the COVID fingers, tend to decrease as inflammation is inflammation decreases, as well as when the disease starts going away. Thank you. I hope I responded your questions. From Transparencia Venezuela, a follow-up to Dr. Barbosa. Can you tell us what is the brand of the vaccine that will be arriving in the country in the third week of November? Dr. Barbosa, do you have detailed information? Well, thank you. Each country is offered the vaccines that are available, and many countries in the region, they can make choices from among the supply. Some people think that certain brands are better than others. The ones arriving in Venezuela will be Sinopharm. It's one of the vaccines that have received emergency use license by the WHO for use in people. Thank you, Dr. Barbosa.
That came out saying that if you've been infected with COVID, would not give you enough protection, so you would need a vaccine. Asking for a comment. Is that true? Does having been infected with COVID give you enough protection so you don't need a vaccine, or the opposite? Maybe Dr. Barbosa, you can clarify this and comment.
No, thank you for this question. This was a very important study that was released this week, at the beginning of this week. And it clearly shows that it's not true. Some fake news that unfortunately in some countries are released saying that if you got the COVID-19, you don't need to get a shot. This is not true. In many countries now, we have good data showing that you can have a second time COVID-19, you can have a new disease because the protection that is provided by the natural infection is limited, and also because you can have a new COVID-19 due to all the new variants. So it was well known. This study clearly shows that it's much better to get the protection from the vaccine. This study compared two groups. One group had the disease and no vaccine, and the other group had the vaccines that are used in the US, the mRNA vaccines. After 6 months, when they compared the two groups, the group that received the vaccine was 500 more protected than the group that only had the disease. So this is a very important information. And for this reason, it's crucial that in every country, the ministries of health develop a communication strategy to cope with this fake news around the vaccine, misinformation that people sometimes are spreading, that even people that had the disease, they still needed to be fully vaccinated against COVID-19. This is the best way to protect them. Thank you.
Gracias, perdón. Dr. Barbosa, muchas gracias.
Thank you, Dr. Barbosa. We have a question about vaccines from Nicaragua. Tina Lopez from La Prensa. PAHO donated more than 100,000 doses at the end of September, but they have not been administered. Do you know why the ministry has not administered this vaccine donated, and what recommendations would you give to the ministry regarding the current vaccine campaign? So this is for Nicaragua. Dr. Ugarte, could you please answer this question? Thank you, Luciana. Well, we have information that the Ministry of Health of Nicaragua has defined or has organized more than 1,800 units, health units for administration of the vaccine all over the country, and that they are prioritizing administration of vaccines that were available before according to the age groups and the risk factors, for example, pregnant women and women who have recently given birth. Administration of vaccines that have arrived in Nicaragua are being scheduled to be administered. I would like to underscore this last point, the donations from vaccines from Honduras to Nicaragua. This is a show of solidarity that is more and more frequent among countries in the region as from countries from other regions for countries with very low coverage rates, and we require even more vaccines in order to protect the population at highest risk. A recommendation thus is for the population to continue to get vaccinated, and that countries use up their vaccines as soon as possible so that protection can be achieved in the shortest possible time. In the case of Central America, we are talking about countries that require more support. We've talked about Honduras, and of course Nicaragua as well, Guatemala, as well as other countries. And in the case of the Caribbean, we also need additional vaccines in order to reach coverage. It's important that those who have not yet been vaccinated get vaccinated. We have mentioned this here several times. To get vaccinated is one of the best protection methods to avoid death or severe COVID, and also at the same time continuing with the protection healthcare measures as long as the pandemic is with us. Thank you. Thank you, Dr. Ugarte. We are coming to the end of the session. We have 5 more minutes, and I think that we have a general question about
that were mentioned in Dr. Barbosa's opening remarks. The question is, are we getting close to the end of the pandemic? Dr. Barbosa, perhaps we can wrap up with this answer. Thank you very much.
Thank you, Luciana, and thank you for this question. I think that first it's important to recognize the efforts that the Ministry of Health in the region of the Americas have made to cope with the pandemic. This was the biggest challenge that we have faced in more than 1 century. And in a region like Latin America and the Caribbean, with inequalities, with poverty and extreme poverty, with many people that live in a almost natural crowded situation in Islam, it was not easy to make the public health measures effective during many months in the region. At the same time, Latin America and the Caribbean, despite the fact that this region was the epicenter of the pandemic, we also had many problems to access the vaccines that the countries needed to protect their population. Despite all of this, working together in a close collaboration with member states, we can see now that we have a clear trend, a sustainable trend in most countries that the COVID-19 number of cases and deaths are declining. However, this is not the end of the pandemic, for sure. We need to remain vigilant. We need to keep all the surveillance systems working in order to identify in a very early stage if we have another increase in the number of cases. We needed to keep all the public health measures. Wearing masks, for instance, can reduce around 20% of the transmission alone. Combined with physical distance, avoiding crowded spaces, it can be a very important pillar to control the transmission. And finally, we also need to get more vaccines to achieve a very high coverage in every country in the region. We have a very different situation. Some countries in our region have now more than 70% of their population fully vaccinated, but the average in many countries around the 40 or 45% of the population. And as I mentioned before, we still have 5 countries that have not yet vaccinated 20% of the population. Let's learn with other countries. This week, Germany and the Netherlands announced the new measures to reduce the transmission after weeks and months of sustainable decrease and a very low community transmission. So the pandemic is still among us and it will remain for weeks and months, and we cannot have the false security impression that the COVID-19 pandemic is over. It's not, and we need to keep the good work in the Ministry of Health. We need to work closely with this ministry, providing technical cooperation to ensure that in every country in our region, the transmission will be controlled. Thank you.
Gracias, Dr. Barbosa. Un mensaje muy importante.
Thank you, Dr. Barbosa. A very important message. We have come to the end of our press briefing today. Remember, you can find more information in our webpage, www.paho.org. And also, the recording of this session will be available in our channels. You can also send your questions to the media team at PAHO.org. That is our email. Thank you very much for joining us today, and we'll see you next week. Thank you. Thank you for your participation.